Welcome to Trust Talk. In today's special milestone episode, we're joined by Professor Andrea Evers from Leiden University. As a leading expert on the placebo effect, Andrea shares fascinating insights into how trust, patient expectations, and even the doctor-patient relationship can shape medical outcomes. From the power of trust in healthcare to the science behind placebo responses, this episode explores the vital role of psychology in medicine. Your host today, Severin DeWitt.
Andrea, welcome to Trust Talk. Today we have something special to celebrate as you are my 100th guest on the podcast.
Wow.
Yeah, so I'm thrilled to have you join me for this milestone episode.
Congratulations.
Thank you very much. You are a psychologist specializing in the placebo effect. That's the subject of today. Can you tell us where your fascination with this phenomenon began?
I think originally I'm particularly fascinated in the interaction between body and mind. So when I was a young child, I thought it's no more interesting to study psychology or medicine. And I couldn't decide. I thought both is so interesting and the interaction is most important. And I thought to myself, what is worse? If you have a problem that you have, for example, lost your leg, or if you can't cope with it. And I decided that not able to cope with this type of situation would be even worse, perhaps. So I decided to study psychology, but immediately with the intention to connect it always to medicine. And some years later, I started seeing what might be the possibilities of the placebo effect. And I was really fascinated because the placebo effect is a perfect research topic where you can both focus on research, but also on clinical practice, where you see all this huge effect of placebo effects and can combine them, but also where you really can study the influence of psychological factors on health and disease. So
many people think of the placebo effect as just a sugar pill or a fake that doesn't really do anything. But as an expert who has studied this in detail, I know there is much more to it, otherwise we wouldn't be having this conversation, I guess. To kick off our discussion today about the placebo effect and its connection to trust, can you explain what the placebo effect really is and why is it so important?
Yes, of course. Yeah, the placebo effect is an expectancy effect. So that means that you have positive expectancy about the treatment outcome, and only the positive expectancy is responsible already for positive effect, like you might know from the sugar pill. The problem with the sugar pill is that it has not a strong effect in itself. So then the placebo effect is only very small. We see much larger placebo effect when there's already a successful treatment, and then the doctor suggests that this might indeed work. And then you see much larger placebo effects because you have then a positive treatment experience from the past that can be enhanced by the placebo effect. So both together work much better. And that's the most important thing about the placebo effect, that you don't only have an effect with a fake pill, but it is an enhancer of the already existing effects of treatment effects.
You mentioned thoughts and how it affects our body. And the other way around, I guess. How can you apply that in clinical practice and then collaborate with lots of disciplines to make the patient better?
Yeah, these are many, many questions in one question. I think we know the placebo effect from this research clinical trials, where we see that the placebo effect is an add-on to the real clinical effect. And that is how we can translate this also to clinical practice. The placebo effect, you could say, is a context factor. So it's everything what is not the medicine in itself. So all these extra effects like communication from the doctor-patient relationship, your own expectations, your own experience from the past, but also the context factors, how the office looks like, how much trust you have in the treatment. So all these factors play a role. And the good thing is for clinical practice that you can all influence them also. So we don't have only the medicine effect, but we have much, much more. The whole context plays a role, and that is the patient-doctor communication, your own experience, the experience of the doctor, the experience of the whole hospital. So everything has to be taken into account, but can also be used for interventions.
You talk about experiences. How can these experiences or learned associations and the level of trust a patient has in the healthcare provider influence their response to placebo treatments? And what implications does that have for clinical practice?
Yeah, it's really important that we understand that the placebo effect is also much more than only the one verbal suggestion of a doctor. Of course, communication is a strong determinant of placebo effects. Only the word pain can induce a lot of negative associations and can already induce feelings of pain in ourselves. So communication is a strong placebo, or the opposite is then the nocebo effect. However, this is only the case because we have all these previous experiences with it. And these previous experiences is a learning history, like we know from conditioning effects. And conditioning effects we know from Pavlov's dog, that the dog has the experience of this bell that is associated with food. And this is an association that the bell remembers the dog, that he receives some food and develop some physiological reactions like a saliva response. So these type of learning experiences also play a role in placebo effects. And that is what you could translate like our previous experience, like a very good doctor from the past where you have a lot of trust, or in the opposite might be also work where you have a medical trauma and you don't trust the hospital anymore. Or the painkiller that always worked in the past. So that is a learning experience that your body already has a lot of experience with this particular type of medication, and that you use these learning experiences, and this translates into the placebo effect as a possibly also physiological effect.
Do cultural and societal differences impact how the placebo effect works, particularly in relation to trust in medical systems and practitioners?
Yes and no, because it's also difficult to study these specific cultural aspects. But of course, we know that your personal learning experience plays a huge role, your positive experience with treatments from the past. And in general, of course, we usually have in a specific society comparable experiences, like a hospital that is really well known for the good treatments, or there's a lot of evidence for a specific treatment. While in another cultural context, these items might be not really important for people. Then totally different things might be important. So because we know that the learning history plays a huge role, of course, then cultural influences also can differ, or that it differs between males and females. But we have to do much more research in this area. One factor we know it is from influence is age. We know that placebo effects are usually somewhat stronger in younger populations, so in children. And this might be indeed because they might be more open for suggestions and more open for these new experiences. But from the other cultural contexts, we really have to do much more research. If you are aware and know that all these learning experiences play a role, of course, we know that the cultural influence plays a role.
You mentioned painkillers. They often stop working if people don't know they're taking them, which shows just how powerful the placebo effect can be. With all the evidence there is, how does your research use this understanding to improve therapy?
Yeah, we use it in many different contexts, but it is indeed very important that when people are not aware of taking a possible effective medicine, it has immediately less effects like these painkillers. So the first lesson we can learn here is that it is very important that doctor or nurse explains what they're prescribing, explain also the possible benefits, at least the long-term benefits, and also explain the mechanisms, why it can work. So if people then understand why a specific treatment might be possibly successful, and that they receive this specific treatment now at this moment with a specific goal, Of course, all these context factors can work and can have an additional effect. So this placebo effect can work, and it's very important. So taking the time to explain what you're prescribing and what the mechanism is of the medicine already has a substantial placebo effect.
Can you explain how previous experiences, such as pain or nausea, can cause the brain to react similarly even without the actual stimulus, and what physiological processes are involved in this phenomenon?
In all physical symptoms, the placebo and nocebo effect, so the opposite is the nocebo effect, can have a substantial effect. And the mechanisms are a little bit the same for the different physical symptoms, as it's for pain, nausea, or itch. And what we see that it is always a combination of learning mechanisms. The first is the communication aspect, that the doctor says, yeah, this might work very well for you, and I've specifically chosen this treatment for you. The second is also social behavior, that we see, that we observe others. Oh, yeah, my neighbor had a lot of benefit with specific treatment. And the third, and that's the most important, is conditioning, so that you have this previous experience with a drug, and that your body automatically responded with the same physiological reactions to the same treatment, because it is a conditioning response like we know from Pavlov's dog. And that is the most interesting mechanism, because it can have directly also a physiological response. We know from immune conditioning that you can combine a drug, for example, cyclosporin is an anti-inflammatory drug, with a specific cue, a taste or a drink, something that it can be easily conditioned, like a little bit comparable to Pavlov's dog. And then you give a placebo together with a drink. And what you see when you only give the placebo, while before you gave the medicine together with a drink, then the physiological system reacts with the same immune response. That is what we call immune conditioning. And that is a very nice proof that the immune system can develop its own response only to the same cues, also without giving the medicine, which is, of course, theoretically a very, very powerful mechanism we should use also for our therapies.
Well, I'd like to talk about placebo's little brother, the nocebo effect. You just mentioned it. And how people in control groups report experiencing side effects simply by reading about them, and even when they haven't taken any actual medication.
The nocebo effect is perhaps even more clinically relevant than the placebo effect, because we know that it can induce a lot of harm without, of course, we have any intention to induce this harm, and only by explaining the risk and side effects of a possible treatment. The first evidence was shown when they looked at control conditions in randomized controlled trials and saw that already the persons who only received the control placebo medication reported the same type and number of side effects, while they have not taken any real medication. And this phenomenon has been replicated in many, many trials for many, many medicines. So it's really clear that this is a very strong component of what we call the nocebo effect, that people develop already physical symptoms while only possibly expecting these negative symptoms while reading the instruction letter of the medicine. So it is very important that we think about how should we inform people about the risk and side effects, because we know that only reading about them can already induce these nocebo effects. At the same time, of course, we have to inform people about risk and side effects. So this is a very complicated balance where we really have to look what might be indeed the best interventions to protect people from developing these type of nocebo effects when we inform them only.
How does the placebo effect manifest differently in children compared to adults? And to what extent does trust in caregivers enhance this effect? I was thinking of the situation where a child falls and their mother kisses the injury. it often helps to alleviate the pain.
Yeah, the kiss against the pain of the mother from the child is, of course, the most well-known example of the placebo effect that always works. And it's such a fantastic effect we should always use, of course. And in essence, it also works in adults, not only in children, of course. Perhaps the children might even believe it a little bit more. But at the same time, of course, the nocebo effect, the opposite, can also work and can have really very traumatic experiences, as for example, in hospitals when children are ill. And the most important difference, of course, between children and adults is, and if you have a child who has already very negative experiences as a child in the hospital or traumatic experiences, it can have long life consequences of how you come into the hospital and how much trust you have in medicines or the medical doctor and so on. So the consequences can be really huge, of course, for children. Generally, the effects are comparable, but what we see is that younger children respond a little bit stronger to placebo and nocebo effect than adults. So it is even more important that we take care of how we explain the effect of medicines, but also possible risks and side effects to children.
How do you see the role of trust in enhancing placebo responses as highlighted by Benedetti in 2005, where high trust in healthcare providers activated brain reward pathways similar to actual treatments? What are the implications of these findings for clinical practice and the design of clinical trials?
The most important consequence of these findings is that we always take into account that the medicine itself is only part of the whole treatment effect. The whole treatment effect is always a combination of the medicine and the context factors that are influenced by the placebo effect. And that's a positive expectation of the patient, but also the positive expectations of the doctor, the communication, and all these context factors play a role and have to be taken into account. And importantly, this is not only what we call a subjective response or feelings. We can see indeed these responses in our brains. Specific brain areas are activated, like reward mechanisms, or in the nocebo conditioning, more the stress mechanisms that play their role. And that they can also induce direct physiological changes, as I explained, of our immune system. So that these extra contextual factors are always part of every treatment effect, and that they can have directly an influence on our brain and our physiological response systems and others, so that we have to take them into account when we treat patients.
You mentioned physicians' empathy and communication style as how does it affect patient outcomes through the placebo. What strategies could be implemented in clinical practice to harness these effects for better patient care?
Yeah, importantly, we have to take into account that patient-doctor communication is a crucial element, not only for the satisfaction of patients and how they evaluate the hospital, but directly also for the treatment outcome and for the disease process and for the recovery, of course, for adherence of the patient. So for all types of clinical outcomes that are so important. And importantly, we have to train doctors to help them also how to talk about placebo and nocebo effect, how to talk about treatments, how to explain to the patient that the placebo effect might work and that it is a positive thing and that's not a problem, but that every treatment consists of not only the medicine itself, but all the other context factors. That is fantastic news, because that means also that you can do something about it. If you have more trust in the medicine, that it might work better. So if you don't have trust, that it might make sense to wait and perhaps have an extra consultation with a doctor to discuss the possible risk of side effects or your doubts why we don't believe in the treatment, so that you take time indeed for these context factors to take them into account. And of course, we have to remember that doctors are not trained at this moment in these specific type of communication skills. So what we did at Leiden and our IPS Center is to develop specific trainings like an e-learning where doctors can learn within 2 hours the most important communication elements, how to talk about placebo and nocebo effects and how can use them to maximize placebo and minimize nocebo effects. But also we have extra tools with virtual reality where they can practice their skills in the specific areas. And of course, these type of interventions on training doctors in these communication skills should be part of every training and education of medicine schools in the future.
Andrea, I always like to end my interviews with a question about the future. What aspects of the placebo effect remain unexplored and present opportunities for future research by young professionals?
Yeah, I think 3 elements are most important in this area. We know already a lot about now that the placebo effect works and that it has specific consequences on the immune system, on the brain activation, other systems. So it's now time to translate this into clinical practice on 3 levels. The first is to support the patients in their own tools, that the patients are aware that their own expectations play a role, that patients are informed, and that they are optimally prepared when they have the surgery, that they are prepared for the surgery and that they can focus on positive expectancies instead of only the fear of surgery. Trainings in this area might be very important. The second is indeed the doctor-patient communication, that we really have more and more tools to train doctors to support them. And the third is the area, and that's perhaps most important, it's the immune conditioning or the pharmacological conditioning, where we use indeed these principles, these learning in principles to train our immune system, and which is frequently applied now in trials where we can reduce medication because we can use these conditioning mechanisms to replace or at least reduce doses of medication. I think this third area is, of course, very, very promising also for the future because it directly then also can have an effect on our healthcare system, on how much our healthcare system costs, on the use of medicine and others. So that might be, of course, very, very relevant to improve our care and, of course, contribute to recovery of so many patients and the treatment outcomes of so many patients.
Well, Andrea, thank you very much for being our guest today. And I wish you all the best and good luck and success with your work.
Thank you.
And I hope that we will hear from you about the placebo effects in the future.
Thank you so very much.
Thank you for joining us for another episode of Trust Talk. We hope that you found the conversation valuable and informative. At Trust Talk, we believe in the power of trust to create positive change in the world. If you believe in our mission, we would greatly appreciate your support. You can help keep Trust Talk going by making a donation on our website at trusttalk.co/donate. Every contribution, no matter how small, helps us to continue bringing you thoughtful and engaging podcasts. Thank you for your support and for listening to Trust Talk. We look forward to meeting you again for future episodes.